pneumonia and severity, and what are the precautions, who are the risk group patients or people. Pneumonia is one of the most common infectious disease across the world, particularly in Southeast Asia, particularly in high population density countries like India. Because pneumonia is nothing but it's an infection or inflammatory cells accumulated at air sacs that are nothing but a distal part of the last part of the lungs. Here the causes may be bacteria, tuberculosis, viral diseases and fungal diseases. Among all, seasonal virus influenza like influenza and respiratory syncytial virus, particularly in infants, are more notorious and more common etiological organisms. Apart from that, bacterial infections will attack once it is preceded by the viral illness. Most of the times, high risk group, one is kids and adults with bad habits like smoking, alcohol, patients on chronic liver disease, chronic renal disease, and patients post-transplant receiving immunosuppressive treatment are risky group. These all are called risky group. These risky group can be prevented, this particular pneumonia, by having a annual checkup and annual vaccination. Vaccination divided into two types. One is influenza vaccine, which has Pneumo-23 and pneumococcal vaccine. In influenza vaccine, it will be used just like a flu shot, not only for the adults of high risk but also for the healthcare professional. Western population, it will be used very commonly. Pneumococcal vaccine will be divided into Pneumo-23, pneumococcal conjugate vaccine, Pneumo-13. Now PCV-13 also will be supplemented by PCV-14. It's a new, just phase 3 trials completed. This is also a adjuvant where extra two variants are covered in this particular pneumococcal vaccine, PCV-14. And these vaccination will be beneficial in terms of prevention. Treatment part comes once the diagnosis, whether it is viral, where supportive measurements apart from the fluvir in influenza, particularly swine flu, and COVID related diseases where oseltamivir, all those things, you know well about COVID. We are a post pandemic state, and sequelae of COVID also will be triggering factor for the various pneumonias. Why pneumonias are more common compared to any other disease? Because lung is the only organ apart from the skin is exposed continuously to the atmosphere with every breath. So there are defense mechanisms right started from the nostril to the division of the bronchi where it can be prevented. In risky groups like alcoholics, all those things, this defense mechanism is hampered so that it facilitates the organism to enter and cause the infection. Thank you.